Mr Fearghal McKinney to move the amendment.
Mr Speaker, and as SDLP Health spokesperson, I welcome the opportunity to bring this amendment to the House, and I just wish that my gratefulness to this House to debate this important issue was matched by a DUP Health Minister who would have welcomed the opportunity to respond, to reflect to the Assembly and to the wider public that he has a plan to deal with the waiting list crisis that is the worst perhaps in health service history here for many years. But no, the Minister has chosen not to be here, and I would urge all of you in this chamber, in the gallery, and even to those outside this chamber, to focus during this debate on that empty chair, and indeed empty chairs right across the benches opposite, for that is the answer that the DUP has given to the debate on this unprecedented waiting list crisis. Absolutely nothing. And I'll touch further on their impotence over health service change later in my contribution. The DUP has put huge public concern over this issue second to their own narrow political interests, which are in favour of a spat between themselves and the Ulster Unionists. Good luck to them, Mr Speaker. I hope the public responds in kind, and that public remembers that in their hour of need, the Health Minister ran away. At the outset, I want to acknowledge that today's debate is a very important one. In every debate that I have participated in, I have acknowledged the dedicated professional approach of the nearly 55,000 staff employed by the health service here. I have applauded their commitment, their energy and compassion, and I do so again today. The pressures that are on our elective care waiting lists are as much a strain on them as on the public and those in need. The figures have been rehearsed over and over in the public domain among health professionals and also in this Assembly chamber. They are disgraceful, and action is called for, not retreat. Waiting lists are the worst they've been in 15 years. We've seen outpatient waiting lists swelling by 46% in the past year alone. This is creating great difficulty for many patients, at the worst end, even contributing to deaths caused by system stress, or the frail and the elderly being humiliated and neglected. Mr Speaker, I know this firsthand. My constituency office, like those of other members, has been inundated over the last years. I've heard harrowing stories, and many of these people are suffering, are in agony with no end in sight as to when they'll receive treatment. And in the 21st century, this is simply unforgivable. And this morning we will hear more stories similar to those. These are important contributions, but ultimately their resolution and future resolutions will not be mitigated until there is a proper strategic focus at the heart of our health service, followed by implementation. And strangely enough, Mr Speaker, there is one. It's just that it's not been implemented. And I should know, because I've spent the last 2 years constantly asking questions about its implementation, only to be fobbed off with obfuscation. First of all, reassurance, it was all being implemented, that there were targets in the Transforming Your Care plan. Then, as the questions piled up, the evidence began to disappear, and in the end we had another review which basically called it as it was: failure of leadership, failure in commissioning, failure to deliver. Of course, there were bits of movement here and there, but you tell a public that watches in disbelief as the crisis piles up that that's improvement, and they've real cause not to believe you. Mr Speaker, the present crisis in elective care was always going to happen. The reason: the health service cut the budget on elective care surgery. The reason for that: they needed resources to plough into the system to prevent the accident and emergency crisis that dominated the headlines for 2 years. The reason for that: the health service was not properly budgeted for, and a plan that they had come up with was not implemented. So moving money and staff did prevent the A&E crisis, but the elective care waiting list just grew and grew.
Would the member give way?
I will.
I'm very grateful to the member for giving way. The member will know, as a member of the Health Committee, that some time ago we were informed that a bid for £89 million had been put into the Executive in order to overcome those problems. out of the June monitoring round. That June monitoring round has not even been spoken about. £89 million has not come towards the health service, so therefore we're going further into the red as far as treatment is concerned.
Absolutely. And what would you have welcomed today? A health minister, or even some health committee members from the benches opposite, to potentially explain your very point. The process has been a sticking plaster approach, short-termism, Mr Deputy Speaker. Historically, the Department of Health relied on the private sector to effectively pick up the slack in addressing the elective care backlog. But again, due to financial and strategic mismanagement, this funding is no longer available. The Department has consistently bid for that extra funding, my colleague has helpfully mentioned, in monitoring rounds, and when the money ran out and when the focus was on the other big crisis, the route to the next crisis was fixed. Very briefly.
Members made reference, and I have to agree with him, the absence of our in-out health minister today and his former colleague who was health minister. But can I make it clear, no matter what spat within unionism, I think the member made a comment on, the Ulster Unionist Party is here today because we care. And I agree entirely with the comments made by my colleague. We care about our constituents. They're in our offices day in, day out. The picture from today is the absent seats to my left.
Order, please. Can I remind members, please, interventions are supposed to be brief and relative to the point. Continue.
And perhaps I would have bought that point, Mr Deputy Speaker, had the DRD Minister not resigned, and is it entirely appropriately reflects that when he doesn't care about our roads system. But anyway, it's unsustainable. The situation was foreseen. Over 4 years ago, authors of the TYC plan considered future demand and present stresses. They consulted, and I'll tell you what they said in 2011. I'll read it to you. Demand would rise by 4%, and that would lead to an increase in 50,000 outpatient appointments in 2015, and that a failure to act would quite simply, quote, fail the population as the system struggled to cope. Deputy Speaker, by any measure, the population here has been failed. And here we are in September 2015 with no health minister to address an issue which is impacting on 1 in 5 people here. The public is rightly angered. I said at the outset that I would address one of the core issues at the heart of the problem. It's leadership, Mr Deputy Speaker, at the highest level. And this House and the public is right to ask, why is it that a queue of DUP ministers has failed them so badly in health? First, Edwin Poots, who attracted more publicity over conscience issues than health, failed to implement the plan and failed to secure sufficient budgets to run the system. His exit bought the DU more time to attempt to explain away their failure with a new minister, Jim Wells, who used up that vital time dithering and focusing on more conscience issues. All the time, the queues were growing as the public were ill-served. And now we have, or maybe we'll have, the absentee minister in for an hour or so at some stage next week until he resigns again. Here we have the man with a disappearing plan. No, I can't give away any further. Who would sooner resign his ministry than confront the issues that are affecting so many people here. Mr Speaker, right there, is his empty seat. That there is his response. Very briefly.
Would the member agree with me that the real renegade and roguish ministers in this House are those who are absent today, and especially in this context, the Health Minister?
Thank you for your helpful intervention. I couldn't agree more. It's not only, Mr Deputy Speaker, that the DUP has no answers. The reality is they are to blame. They've had their chance. They've failed and failed miserably. There is still a chance. It is around the concepts and the strategic thoughts around TYC. At its core, it saw the strain on the health service, as I've already reflected. All of this stands in stark contrast to how TYC systems were introduced, for example, in Australia, and where the transformational change, for example, in Canterbury, reduced strain on the hospital and expensive end and worked very well. Can I just turn to the Ulster Unionists who may be thinking of not supporting the amendment? We are saying quite clearly to take immediate action to alleviate current pressures, and in that we're saying find the money now to treat the patients now, and marry that to a further strategic TYC plan. So I would urge your support in that context. for our amendment. Mr Deputy Speaker, I think the picture is very clear. It's one of failure, it's one of no response, and the public is rightly disappointed. I urge your support for the amendment. Thank you.